So we are here with Mr. Duggan. And Mr. Duggan, what does a Certified Registered Nurse Anesthetist do?
So a CRNA is an advanced practice registered nurse. So it's someone that had started as an RN, a registered nurse, and then got additional training to be an independent practitioner. And then once you have that training, you are licensed to deliver anesthesia to all different types of patients for all different types of surgeries in different environments.
How did you end up choosing this field?
So when I was in high school, I met a guy that had just finished CRNA school, and he asked me what I wanted to do with my life, and I wasn't 100% sure. I knew I wanted to go into the military, and he was like, I want you to sit down with me for a little while, and I want to tell you about what I do, and I'm going to tell you about how to do it efficiently so you're not wasting a whole lot of time in college. And so he did, and then I shadowed him at the hospital, and I knew that day that I wanted to be a CRNA, and I just followed the roadmap that he had put out for me, and yeah, the rest has been history.
Great. And what is that roadmap that he told you about?
Yeah. So he did tell me the importance of getting good grades first of all, because CRNA school is very, very competitive. So he said, but then he told me to, apply to nursing school. After I got accepted to nursing school, he told me about certain classes that I should take in addition to my college classes, like basic life support, EKG interpretation, ACLS, which is advanced cardiac life support. And these are all just, day classes. Some of them are day classes, some of them are like, 8 to 10 week classes. But just go ahead and get that experience because it was going to help me when I was in nursing school. And then once I finished nursing school, what he had encouraged me to do is to get into an intensive care unit as soon as I could, because one of the prerequisites for CRNA school is you have to have a minimum of 1 to 2 years of ICU experience. So that's what I did. And because of those classes that I had taken that he had recommended while I was in nursing school, the intensive care unit director had agreed to hire me into ICU for my very first day as an RN. And then as soon as I had worked for 1 year in ICU, I had applied to anesthesia school, and I got accepted, as soon as I had applied, and I started about 6 months after that.
Tell us a little bit more about CRNA school.
Sure. So first of all, one of the neat things about CRNA school now, if you started last year in a CRNA program, you would come out with a master's degree. Now, when you start CRNA school as of this year, you will come out with a doctorate degree. So that is a new change that has happened this year in 2020. And CRNA school, there's lots of different models, but typically your first year will be a lot of didactics. So you're going to be in the classroom, you're going to be learning your pathophysiology, your pharmacology, your basics of anesthesia. And so there's a lot of that the first year, and you'll have a few days in the operating room just so you can kind of start to get acclimated to that type of environment. And then as you transition over into your second and third year, you're almost exclusively in the operating room, because the rationale there is the best way to learn how to do anesthesia once you have those foundational skills is to actually do anesthesia and administer anesthesia. So most of the first year, didactics. Second and third year is mostly clinicals. We're actually doing hands-on anesthesia.
Where can you be a CRNA, and what type of jobs can you do with it?
So great question. That's one of the best things about this career field is that there are so many options. If you do anything for a while and you said, something, I would like a different challenge, or I would like a different environment, you can do it. For instance, a lot of CRNAs work in hospitals. So you can work in a very large hospital, level 1 trauma center, where you're taking care of, the knife and gun club people that have gotten stabbed, shot, car accidents, that kind of thing. So if you enjoy that high adrenaline, you can do something like that. If you enjoy just the normal, what we would consider bread and butter type surgeries, like knee replacements, hip replacements, colon resections, appendectomy, stuff like that, you could work at just a normal size hospital. But some people enjoy outpatient surgery, where you're doing like plastic surgery, or endoscopy centers where people are having colonoscopies. And then there's military environments. So if you wanted to go into the military, you know, you can do anesthesia at a military hospital here stateside, or you can deploy and do anesthesia over in foreign countries in wartime situations. So there's all sorts of different environments that are available to you.
What about pregnant ladies too?
Great question. So that's one of our responsibilities as well, is to do labor epidurals. So a woman has come in for an induction for childbirth, and as they start to progress in labor, it's pretty uncomfortable. So most of the women that come to our hospital do request a labor epidural. And so we put those in, and if, for instance, if that patient then needed to have a cesarean section, then if they didn't have a labor epidural for whatever reasons, then we would put in a spinal block for that as well. So that's where we just put a small injection of local anesthetic in the small of their back and makes them numb from about their rib cage all the way down for about 2.5 hours, so that they're completely comfortable while the obstetrician delivers their baby.
What are the risks in this job?
So the risk to anesthesia, and this is something that we talk to all patients about when we're getting informed consent before we administer an anesthetic. So anytime we give you anesthesia, it can affect your heart, it can affect your lungs, it can make your blood pressure, your heart rate go up or go down. We always tell people about the very distant risks of a heart attack or a stroke. If we're putting a breathing tube in, there's a chance of a fat lip or a chipped tooth. Always a chance of nausea after having anesthesia. So those are some of the more common risks, like nausea, you know, maybe being a little sleepy for a little while afterwards. But the important thing that I like to stress to people is anesthesia is safer today than it has ever been, and you take far more risk driving to the hospital to have your surgery than you do having anesthesia.
What type of person does it take to be a CRNA?
So you have to be very motivated, and that starts when you even consider, really at the high school level, or whenever you've made that decision that you want to be a CRNA, because you do have to study hard. You have to take the initiative to do what is required to get into the program, and as we've already mentioned before, it is very competitive. So that's important. And then once you are in anesthesia, like we often joke, you know, in that you have to have a little bit of OCD. You have to be a little bit of obsessive compulsive, because there are certain things in anesthesia that you cannot control. For instance, if someone comes in that has a bad heart or they have a bad lung, there are certain things that you just can't control when they come in. So the things that you can control, you want to control. For instance, you want to make sure that you have all the drugs necessary that you need to take care of the patient, to put them asleep, but also to treat any sort of emergency that might come up. And some of them you can't even anticipate. They just come up, you know, in a very, very, you know, short period of time. So you've got to be prepared to deal with those things. Also, like airway emergencies. You know, if somebody stops breathing, or there's an emergency on the floor, you hear about like a code blue or something like that. You've got to be prepared to deal with those things at any moment. So part of that is being prepared, and part of that is the responsibility to know what you're going to do in the event that one of those things happen. And one of the things that comes along with that is being cool under pressure, okay? Because when those things happen, you have got to be the calm person in the room, okay? Because oftentimes you might be in a room with people that are not familiar, or they don't deal with emergencies all the time. And so those people sometimes panic. But if you are the calm person in the room and you're basically saying, listen, everything's gonna be okay, this is what we're gonna do. A, B, C, X, Y, Z, I need you to do this, I need you to do this, I need you to do this. And immediately when you take that sort of attitude, people in the room start to calm down because they know that somebody's in control. So those are some of the characteristics that will help you be successful as a CRNA.
What are some of the differences between an anesthesiologist, a nurse anesthetist, and a anesthesia assistant?
So an anesthesiologist is a medical doctor, a physician that has gone to 4 years of undergrad, then 4 years of med school, and then usually they'll have anywhere between 2 to 3 years of a residency in anesthesia, okay? A CRNA will have, excuse me, will have 4 years of undergrad, and then a year to 2 in ICU, and then they'll have 3 years of anesthesia training. An anesthesia assistant can have a bachelor's degree they have to have a bachelor's degree. It can be in a variety of fields. It doesn't have to be in anything medical related. And then they have 2 years of anesthesia training. Anesthesiologists, of course, can work autonomously. They can work by themselves. CRNA can work in a care team environment with an anesthesiologist, or they can work autonomously. And then an anesthesia assistant can only work with an anesthesiologist. So,
great. What type of salary ranges do those 3 positions have?
So an anesthesiologist, most of them will start around $400,000, and they can go up from there depending upon what their specialty is. For instance, if you only do hearts or transplants or something like that, that could go up $400,000, $500,000, $600,000 a year would be the typical range. A CRNA in the Charlotte area right now, out of school, you will start somewhere between $150,000 to $160,000. After about 7 to 8 years, it's probably around $190,000. And then in the 90th percentile in the Charlotte market would be somewhere around $300,000. And again, if you are motivated to work and pick up some extra shifts, it's easier for that number to go up. Okay? And then an AA, an anesthesia assistant. You have to keep in mind they're not licensed to work in all states. So certain states they can work, certain states they're not allowed to work. But typically they're going to be starting somewhere around $80,000 to $90,000, and then that typically can go up to anywhere between $120,000 to probably $140,000.
What type of insurance do you have to carry?
So anybody that delivers anesthesia does have to have malpractice insurance. How much of coverage you need to have will vary depending upon the state that you work in, and also some hospitals will require more. My first 15 years as a CRNA, I worked as an independent contractor, so I had to provide my own malpractice insurance. And when I first started out, it was only about $2,000 to $3,000 a year. And then when I finished, working as an independent contractor about 4 years ago, I was paying about $8,000 a year. And then I went to work for a larger hospital system. So now I work for Atrium in Charlotte, and as a W-2 employee. And so as a W-2 employee, the hospital system would be required to provide you with malpractice insurance. So I haven't paid for malpractice insurance for about 4 years, but the hospital has a plan that does cover me, and if anything were to happen, they would take care of it.
And why do you have to have malpractice insurance?
So you have to have malpractice insurance to protect yourself and protect your family as well. So for instance, in the course of doing anesthesia, sometimes complications arise. And it's one of the things that you learn early on when you're in your anesthesia training, that you can do literally everything right, but there can still be a bad outcome. I'll give you an example. So you could be doing surgery for somebody that just a routine surgery like a hernia repair or having their gallbladder removed, and maybe that patient had undiagnosed cardiovascular disease, and let's say they have a heart attack when they're in anesthesia, under anesthesia. Some people will hold you responsible for that, even though they've had coronary artery disease. Maybe they've had some of the risk factors, but they ignore them. But because they had a heart attack under anesthesia, they may try to blame you for it. And so you need somebody that's going to be there to defend you and to defend your rights in a situation like that.
What are some pros and cons of the job?
Okay. So pros, it is really, really neat, and it is great to be able to take care of patients when they're most anxious, and know that you have the ability to alleviate that anxiety, to give them medications, to help them relax, and then also to deliver a safe anesthetic to them. So that's nice. It's part of my ministry as a Christian. I love praying for my patients, with my patients. So I feel it's a way to do that. And also as far as job security, you know, one of the things that we've learned this past year in COVID is that there's not job security in all jobs right now, you know, and so that's one of the things that there's always job security as a CRNA, and if you want to work, there is a job for you. So as far as the cons, it's a stressful job. You know, you take care of sometimes the sickest of patients. You know, from really old to, you know, you can work with really small babies. So that's stressful. And the other thing is, and it's the nature of emergencies, they happen on nights and weekends and holidays. So you know, so you can expect that there's a lot of positions that will require you to work nights, weekends, and holidays. And so you'll miss out on some holidays with your families because of that as well. And yeah, and those are basically some of the cons.
What are some suggestions you have for students while they're in high school to get prepared?
Yeah, so that's great. Yeah, the more that you can take advantage of classes in high school that you're actually not having to pay for, the better, because once you get out of high school, you're going to have to pay for some of those classes. So keep that in mind. So anatomy and physiology would be very important. Health sciences that I believe you all have over at the ATC would be very important. Medical terminology is helpful. Biology, chemistry, algebra, calculus are important. If you can get your CNA, you know, Certified Nurse's Assistant, if you can do that, that is very, very important if you want to get a job while you're in nursing school as a CNA, or specifically in the intensive care unit. I can't stress that. That is way more important. If you can get in ICU, it's just going to help you later on. But essentially, an ICU technician is a CNA that works in ICU. So if you can get that experience, you are already going to be ahead of a lot of people that you're competing with.
What is some knowledge that you have learned that would have been helpful to know in high school?
So a few things. First of all, you know, your attitude is so important, okay? You've got to be motivated. The other thing is, you know, college is really expensive, and it's only getting more expensive. So if there's anything that you can do to minimize the amount of debt that you have when you finish college, do it. If that means taking classes here, like advanced placement classes, or getting some college credit for free here, wonderful, do it. But the other thing is, there is absolutely nothing wrong with going to a community college first. With those credits are a whole lot cheaper, and most of them are going to transfer over to your four-year degree anyways. I did that myself, and I saved a lot of money going and getting my two-year degree first, and then transferring those over to your four-year degree. So anything you can do to minimize the amount of debt that you're starting your career with, the better.
And what would help them with getting into the school? What type of things do they have to look at for getting into the CRNA school?
Great question. So most schools, there's three criteria that they look at, okay? They look at GPA, it's very important. They look at your GRE scores, or your graduate requisite exam, and they look at your interview, okay? So the first two, everybody's got a good GPA when they're applying to anesthesia school, and you have to keep that in mind. That is very important, okay? So I would say that you're gonna have at least a 3.5 GPA for your undergraduate classes. And then your GRE scores, those numbers are always changing. So I would say just look, each school has different criteria there. But you know, typically, you know, on a 1,500 point scale, you're going to be wanting to at least have a 12 to 1,300 on that. And then the other thing is the interview. The interview is very, very important, because you can have a great GPA and you can have a great GRE scores, but if you come in for the interview and they don't think you look motivated, or that you don't have some of those qualities as far as the drive, the determination that you're going to need to finish anesthesia school, they're not going to admit you. So those are really important. They also want to know that this is something that you have been considering for a long period of time. This isn't just something that, oh, I heard this is a good career field. You know, when I sat down for my interview, I told them this is something that I started on in high school, okay? And I've done all of these steps along the way to prepare me for this day. to get accepted to this program. So that really does help as far as the interview is concerned.